Hello guys, my name is Ramila Purasaini and I'll be talking about the opiate crisis and possible breakthrough treatment options to avoid relapses. First of all, what is opiates and how did they start? Well, in the early 1900s, pharmaceutical companies started prescribing drugs like morphine in order to relieve pain, and soon they started prescribing it for various other medical treatments, which led to misuse and abuse, and soon everybody realized highly addictive nature of such medication. Soon the opiates related overdose started piling up, killing thousands of people every year. Just in 2015, more than 33,000 people died due to overdose. Can you believe it? And about 90 people dies in America each day due to opioid use. That is a lot of people, and I didn't know about this until I started doing this research. So this is very surprising. Opiates, opiates are a class of drugs that includes illegal drugs like heroin, synthetic drugs like oxycodone, Vicodin, and fentanyl. They are commonly prescribed as pen medications, but since these medications have high risk of addiction and dependency, drugs like fentanyl have been completely banned from the United States. These drugs work by interacting with brain cells, by relieving a patient from pain, or in many cases producing effect of euphoria, which causes misuse and addiction. Misuse and addiction of opioid has been a serious national crisis that affects public health, social, and economic welfare. Even our President Donald Trump declared the opioid crisis a public health emergency, and many news channels are reporting covering this outbreak as of now. To prevent this issue, the health organizations such as a U.S. Department of Health and Human Services are working together to find new ways to solve opioid misuse and investing on research for treatments by working with different pharmaceutical companies to come up with effective treatment. So the agenda per National Institutes of Health for Prevention and Control are improving access to treatment, developing safe, innovative medications to fight addiction and overdose prevention and reversal addiction. Some states with comprehensive initiative has encouraging results. For example, Washington State implementation of prescription during monitoring programs has reduced opioid deaths by 27% between 2008 and 2012. Widely used treatment options in present days are methadone and buprenorphine. They both activate the opioid nerve cells and have long half-life. So what is the basic idea of this medication is to produce an effect on receptors so that patients can discontinue opioid use without withdrawal. Depending on the level of addiction, these drugs are prescribed to the patients. So both of these drugs may have similar side effects to that of other opiates use. Most concerning of all is that both drugs may be easily abused since they are both available in pills and very well act as a replacement addiction. So what are the new treatments now then? So first of all, I'm going to talk about the relapses. Relapses is very common among drug addicts. It is easy to slip up and go back to the treatment options. Recently, there has been some treatment options available that may avoid relapses for many drug addicts. One of them is Vivitrol, the one which works by blocking the effect of opiates on brain cells. This injection could last for about a month, like a whole month. The time to relapse was seen to be significantly longer for Vivitrol. And another new treatment option is a long-lasting implant that releases a semi-synthetic opiate, buprenorphine, which works for a period of 6 months instead of daily doses. So both of these medications have been seen very beneficial to the patients who are undergoing relapses as of now. So for my take-home message, abuse of prescriptions and non-prescription. Opiates poses a serious challenge on all public health today, as of today, and in order to overcome this extremely complex, main issues in the National Institute on Drug and many federal agencies are working together to find a common solution by coming up with effective treatment options for addicts with less negative consequences and long-term healthy effect. Hopefully this research that I did made you understand what does opiates does and how is it affecting in today's world. Um, Honestly, by doing this research, I learned a lot. Just opiates use. I had just seen like opiates. Oh, what is opiates? And it was causing death. But when I did this research, it helped me a lot to understand. So hopefully, it helped you as well. Thank you very much.